Namaskar and very good morning to all of you. Myself Dr. Sanjay Bhadada. I am currently working as Professor and Head Department of Endocrinology at PGI MER Chandigarh. I am briefly going to talk about the talk title, that is Diabetes and the Bone. Diabetes and bone is generally not a well-known entity in the medical fraternity, but I want to tell you that we generally talk about the triopathy in diabetes, that is the nephropathy, retinopathy, neuropathy. Very soon this triopathy may be replaced with the tetropathy, and that is the diabetic osteopathy, and which is also one of the microvascular complication. In diabetes, the risk of fragility fracture is increased significantly, and it has been said that in the type 2 diabetes individuals, the risk of hip fracture is almost 2 times as compared to the general population, while it is even much more severe or serious in type 1 diabetes, where the risk of fragility fracture is 5 to 6 times higher as compared to the control population. In diabetes, the bone is affected by multiple ways. That is because of the inflammatory markers, that is because of the advanced glycation end product deposition in the bone, and that ultimately leads to a state of low remodeling, low bone turnover in the patients of the diabetes. Diabetes actually affect the cortical as well as the trabecular bone, and in addition to that, there is a lot of other factors that also predisposes for the poor bone quality and quantity, and some of them are associated complications like the diabetic nephropathy and then vitamin D deficiency. In addition to that, the individuals with diabetes are predisposed for the frequent falls, and those are because of the involvement of the diabetic foot, because of involvement of the diabetic retinopathy, because involvement of various drugs those are used in the treatment of diabetes makes them more prone for the fall. And the various drugs those are used for the treatment of diabetes can also harm to the bones, and among them the most important drug is actually the glitazones or the pioglitazone, which harm the bone and that can be made the diabetic bone more fragile. Now lot of new drugs are coming for the treatment of diabetes, and some of them are useful and can be used for the treatment of diabetes. If the person of diabetes is having osteoporosis, what are the treatment options are available? So the various drugs are available for the treatment of osteoporosis in diabetes. The current recommendation is that you can use as a non-diabetic individuals a first line drug like zoledronate, or followed by teriparatide denosumab. At the PGI Chandigarh, we are doing a very nice randomized control trial to study the effect of anti-osteoporotic treatment and their outcome in patients of type 2 diabetes. So maybe in next 1 year or so, we will be able to tell you that what is the ideal treatment, anti-osteoporosis treatment for diabetes with osteoporosis. Dhanyavad. Thank you very much.